Association. And I am very pleased to welcome you to our third quarterly meeting of 2021, back in person. And we are all very, very excited about that, of course. Let me start by giving a huge thank you to Laso Health, headed by Dr. Reza Mizani. Thank you so much. A round of applause, please. This is an amazing venue, and I can tell that when the meetings advance and the chapter grows, the venue seems to progress too, and that's a really good sign. I think it is. But let me tell you a little bit more about Laso, because they have something running that I want you to really help with if you can. They support a program called RIP Medical Debt. And if I understand the program correctly, it's a nationwide initiative. It is backed up by people who have made sure that everything goes right. You can go on research that online. What they do is they buy medical debt notes, and then they go into communities and surprise people with a letter in the mail, your debt is forgiven. How awesome is that? What an amazing way to support a community. And what is even more amazing is that if you donate $1 today, the medical debt that is erased is increased by a factor of 100. So we can achieve amazing things here tonight together. We have the QR code here on our slides. You are also more than welcome to talk to Dr. Mizani or Noah Almanza if you need help with making a donation for that cause. Furthermore, I want to give a big thank you to Helping Others Daily with Karlo Rodrigues here, who is manning our live stream efforts. We are in times where people demand an online option, right? It's no longer just in person, how can I watch you online? Karlo is doing this for us tonight for free, and I want you to give him a huge applause as well, please. I want to thank Dr. Roger Moczygemba, the other co-founder of the chapter with RecMed Clinic. He is really pushing the movement here in San Antonio, and a lot of what you see here today is his brainchild. Thank you, Dr. Roger Moczygemba. Where are you? There you are. I want to thank the entire SHANKX team, which is my company, for making the technology happen as well. Tonight we will, after I have given my little presentation about the values of the SAFMMA, we will hear from Dr. Moczygemba a few opening words, and then our keynote speaker, of course, Byron Hugley. Thank you so much. I always tell you guys at these events that I came into this world as a layman when healthcare is concerned, and I'm learning so much, and it's really difficult to understand the complexities of health insurance and how it works with PBMs and all of that you all know probably better than I do. But when I spoke to Byron, he made that so clear to me that really I had several epiphanies during the conversation with him. And I think you will find that you will get an even clearer picture tonight during his presentation about how all of that works together. And I'm very much looking forward to your presentation, Byron. Then after the presentation, we will hear from Dr. Mizani who is a visionary, who is someone who takes his knowledge and his passion to help people and goes several extra miles to put together an app that you will see is the perfect example of how we can make all the different puzzle pieces fall together so that we create a free market that is increased by the leverage of technology. And you will see that during his part of the evening tonight. After that, we have a microphone set up there where we welcome and encourage questions. So you can form a line here and come and ask questions directed to either Byron or Dr. Mizani if you wish to do that. You can sign up as a local chapter member for free on our website sanantoniofmma.org. You can become a member of the nationwide organization at fmma.org. Let's see, what else did I have here? I wanted to thank a few people who made themselves available for an interview, which again helps us to even spread the word more. David Ballat, who is the director of the Right on Healthcare. David, thank you. Melody Newson, who is the newly promoted CEO of the Bexar County Medical Society. Thank you. Jacqueline Hall, who is the field representative of Congressman Chip Roy. Thank you. And Dr. Hamad Mizani, who spontaneously decided to also be available for that interview. The pillars of the FMMA are, we want to focus on the care and not so much on the price. We want to shop for care. We don't want to shop for a price list. Furthermore, we want to provide value based on transparency. We want to be able to see a price, a rate linked to a service, and we want to be able to know the cost up front so that we can prepare ourselves for our procedures or whatever we need. We don't want surprise bills. That is really something that a lot of people throughout the world find crazy when we tell them that that is a possibility here in the United States. Finally, also, we want access on an equal basis, meaning you don't need to have a membership card to get access to certain pricing. Pricing should be equally accessible to anyone. And I believe, one of the things that I observe is that in our previous meetings, a lot of what we spoke about was theoretical framework, and that's good. All the great ideas that progress humanity are based on theory. But at some point, it's really time for something more concrete. And I have listened to so many of the community, and the difficulty is really being able to connect with each other in a way where there is coherence and a standard that is coherent and makes sense. And that is something that was done in a very nice way, leveraging technology. And it took enormous effort. But let me not go ahead of myself and give the lectern to our chapter leader, Dr. Roger Moczygemba. Enjoy your evening. Thank you so much.
Thank you, Shankar, so much. I want to say, first of all, that if it wasn't for Shankar, you might not even know that we're on the map, because that's what he does, marketing, and they do it very well. And he's been a tremendous asset to help me pull this together and spread the word and get the word out so we can do this. So we started this chapter a couple of years ago, and our vision for this area, we started the chapter in San Antonio to promote the free market here, because you know, without transparency, there's not a free market. And so we've always tried to get doctors here to be aware of the free market and post their cash pricing. And then we've also always tried to get employers to these meetings so they're the ones who pay for healthcare, right? And then we also try to get a few brokers that have the best interests of their clients, their employer clients, here also, so they can make it work with, you know, compliance and benefit plans with companies. So we've always tried to get those three parties in this organization, because if we can get them all together and pricing is transparent, then we can create our own free market in healthcare in San Antonio. So that's our vision of what we're all trying to do here. And if you see something here that looks like a value to you, or you know of somebody else that can benefit from what we're doing, please help us grow these meetings. Bring people here, get to know the people here, network, and try to benefit your organization and spread the word. Okay, so we have a meeting every quarter. So that's our goal, is to create a free healthcare market here. I'm not going to talk too much because I want to listen so much to what Byron has to say. He's got some great information. But the one thing I want to say is that we've been doing this for a couple of years. I'm so excited about this meeting because we've got, finally it seems like, some meat that's sticking on the bones with the introduction of Laso and what Byron's going to talk about now, because this is a magical synergy that's coming together here, and I think at the end of tonight you'll get a glimpse of what I'm seeing here, because here with what Byron is talking about is an affordable approach to healthcare that enables a healthcare consumer to shop health, and the more they shop health, the more they can be rewarded for that. But how do they shop health? Well, in comes the Laso Health with their new app and transparent pricing. So I'm going to stop with that and turn the time over to Byron. Looking forward to that, and then we'll wrap up with Dr. Mizani and questions and answers. Byron.
Good evening, everyone. Good evening. Appreciate you coming out. My name is Byron Hugley. I'm actually a financial consultant that specializes in healthcare, income, and retirement for my clients, whether that's individuals, families, and businesses. And what I do is I take a unique approach to helping people find money that they're unknowingly and unnecessarily spending on their health insurance, and help them improve access to their care. I then teach these clients how they can take those dollars and solidify their own financial future, oftentimes without impacting their current lifestyle. Now, a client of ours recently had a laparoscopic cholecystectomy, what normal people call gallbladder surgery. And her story presents a great opportunity to demonstrate the difference between these custom healthcare plans and traditional Obamacare plans. But before I get started, I need to explain how our plans pay their benefits. Unlike Obamacare, plans that often pay wildly different amounts for the exact same procedure, our custom healthcare plans work a lot like Medicare. They pay a defined amount 100% of the time based on a schedule of benefits. Now, this money can be paid directly to the provider, to the facility, or to the individual if they decide to pay up front. In this case, the plan had a set benefit of $9,400 for her gallbladder removal. No deductible, no copay, no coinsurance required. By knowing how much she had to spend and by being a savvy consumer, she was able to use our resources and find a bundled price of $5,100. So not only did she have her surgery paid for 100%, but she was able to put a remaining $4,300 in her pocket for being a good consumer and making a great healthcare decision. Ironically, if she had a high deductible Obamacare plan, she would most likely have paid more for her deductible than the actual surgery itself. Plus, with our plans, they're usually 40 to 60% less expensive, so she's saving all the way around. Now let's use this gallbladder surgery to explore why these Obamacare plans are so much more expensive while offering so much less protection. According to TexasHealthcareCosts.org, an official state website managed by the Texas Department of Insurance, the average Texas hospital reported billing $444,877 for a gallbladder removal. Insurance companies pay on average a total allowed rate of $114,292. For comparison, Medicare, which insures over 61 million Americans, pays an average of $5,525 for the exact same gallbladder removal. This creates some obvious questions. Why are hospitals billing 80 times more than what Medicare pays? And why are private insurance companies willing to pay 20 times more than what Medicare pays? I know what everybody's thinking. Well, maybe Medicare gets a better price because it's the government and they insure 61 million Americans. While that's true, here are some published bundled prices that you can find from some of our FMMA partners. Texas Free Market Medical has an all-inclusive bundle price for the facility, the surgeon, and the anesthesiologist of $6,550. Surgery Center of Oklahoma is actually even less. They charge $5,865 for that same surgery. In fact, Kevin Smith, the medical director of the Surgery Center of Oklahoma and one of the founders of the Free Market Medical Association, recently said in a video that they've changed their price 4 times since placing them online. In every instance, they've decreased the price that they have online. So back to that elephant in the room. Why would Obamacare and other fully insured plans be willing to pay up to $114,000 for a $5,500 surgery? Well, the answer is simple. These plans make their money off of how much they spend, not off of how much they save. So by spending 20 times more, they stand to make a significantly higher profit. So the insurance company wins, the hospital wins, it's the patient and the frontline doctors that lose. This means that insurance companies would rather you have a heart attack and a $150,000 quadruple bypass surgery than give you a $100 primary care visit and a $30 high blood pressure medication. In fact, it's against the insurance company's best interest to keep you healthy, spend your premium dollars responsibly, or stop the waste, fraud, and abuse that's rampant in our system. All of these things drive up costs, so they drive up profits. As you can imagine, that's a pretty solid business model, which is why 7 out of the 8 Fortune 500 companies in America make a significant revenue off of healthcare. And with all that money being spent, probably shouldn't be a surprise that when Harvard did a study on bankruptcy, they found that 62% of bankruptcies were due to medical issues, and that 78% of those people had health insurance. But it doesn't have to be that way, especially if you're part of the 85% of the population that's generally healthy. With the help of our insurance partners, we build custom healthcare and income protection plans that reward people's good health and lifestyle. These plans, again, are generally 40 to 60% less expensive, offer better access to care and freedom to see any doctor that you choose, including direct primary care doctors. Plus, you have a greater level of financial protection if you become sick, injured, or disabled. Unlike Obamacare plans, these plans actually benefit from keeping you healthy. They want you to get that high blood pressure taken care of before it turns into a heart attack, that high cholesterol before it turns into a stroke, and that high blood sugar before it becomes diabetes, which leads to kidney failure, blindness, amputation, and heart disease. And because of this, they offer first dollar coverage. There's no deductibles, no co-pays, no co-insurance required for routine and outpatient care, including outpatient surgery. Now, when the financial goals of your insurance company align with your goals of staying healthy and your doctor's goals of keeping you healthy, some amazing things can happen. So let's look at this in the real world. Let me give you a case study. It's one that's close to me because it's my actual family. My wife has this coverage and she pays $269 a month for her plan. Her custom healthcare and income protection plan includes a nationwide PPO network, 24-hour accident protection, out-of-pocket protection, catastrophic and balanced billing protection, critical illness, critical injury, chronic illness, terminal illness, and income protection. So it's way more than just healthcare. For comparison, an Obamacare plan, a gold HMO plan, would cost her $498 without all the extras. So she's getting more coverage, and she's saving $2,748 in premium each year up front. Now, one morning she was walking down the stairs and tripped down the last 2 steps. She ended up torquing her back, which caused her significant pain. Initially, she thought she could get that treated by a chiropractor. She would later find out through a lumbar spine MRI that she had a herniated disc and a pinched nerve. She sought the advice of an orthopedic surgeon and a second opinion from a second orthopedic surgeon before she made any decisions about her back surgery. Over the course of about 3 weeks, she had 1 chiropractic consultation, 6 individual adjustments, 2 teledoc visits because the chiropractor couldn't prescribe any medications, a lumbar spine MRI, an orthopedic specialist visit and an x-ray at 1 hospital, a second orthopedic specialist visit at a separate hospital, and 2 prescriptions. Now, some of these things were paid for with cash and reimbursed. Some were run through the PPO network, and we received a check back. When it was all said and done, she had 100% of her care paid for, plus she was able to put $1,215 back in her pocket for making good healthcare decisions. In fact, here's actual EOBs and checks that we received from our insurance. The first one shows she paid $276 for her chiropractic consultation and 4 of the 6 chiropractic visits. You also see on here $250. Actually, it's the last slide. Sorry, I don't know who's controlling that. 1 slide forward. Nope. Now we're way off. Go back 1. Again. There we go. Leave it there. Sorry. $250 that she paid for a lumbar spine MRI. And even though we only spent $526, we actually received a check back from the insurance company for $1,180. That money's ours. We put it directly in our bank account. Next slide. Here's another example. It's one of the specialist visits that we had. This particular visit was run through our PPO network. As you can see, they billed $278. With our network discount, it reduced that price to $117. And since our plan pays $200 for specialist visits, we were able to put $82.66 back in our pocket. Next slide. And last but not least, here's an EOB of our x-ray. Now again, this was done in a hospital, so as you would expect, it would be a little bit more expensive. And in this case, it was $121 that was billed. The PPO discount, the total was $72 for the actual x-ray. Our plan pays $240 per day for x-rays, which means we walked away with a check of $167.43, again, that you can see on the screen. For comparison, had she had an Obamacare plan, based on the plan summary for that gold plan, she would have paid somewhere in the neighborhood of $1,570 in deductibles, copay, and coinsurance for the exact same services. That doesn't even include the fact that her doctor would have to approve for her to see that chiropractor and also both of those specialist visits. So overall, her experience would be very different. So let's think about this for a moment. She would have paid $1,570 for her care. She's already would have been paying $2,748 in extra premium, and she would have never received that $1,215 back from the insurance company, which means that's $5,533 more that she would have paid for inferior care. I know what everybody's thinking. Well, what if something crazy happens, like cancer? Wouldn't you want an Obamacare plan that has the unlimited benefits? Well, I'm glad you asked. Let's take a look at it. So the American Cancer Society tells us that nearly 40% of Americans will be diagnosed with cancer in their lifetime. That means that you and your family at some point are likely to be touched by this disease financially. So what should you expect if you are? Well, AARP tells us that the average cost of treating cancer is $150,000. And what about the out-of-pocket costs of cancer? The American Journal of Medicine did a 12-year study, and they found that 42% of cancer patients expended their entire life savings by the second year of treatment, and that number jumped to 80% by the fourth year, with the average expenditure being $92,000. So cancer is basically a $250,000 problem, plus you have to find a way to replace your lost income. Now, assuming that my wife's treatment all happened in 1 year if she got cancer, what does that $269 in premium buy her? Well, she gets access to a nationwide PPO network that actually has the top 3 cancer hospitals included: MD Anderson, Memorial Sloan Kettering, and the Mayo Clinic. In addition to that, her hospital protection basically zeroes out her deductible. She has a base health plan that pays $250,000 in healthcare benefits each year. She also has a catastrophic imbalance billing protection, which adds an additional $250,000 in protection, which means she has over $500,000 for a $150,000 medical treatment. What about the $92,000 in the lost income? Well, we included income protection in our plan. In this case, it was critical illness. So for moderate to terminal cancer, our family would receive anywhere from $200,000 to $850,000 directly into our bank account to spend on whatever we want: experimental treatments, health plans outside the United States, pay our bills, take a vacation. We could do whatever we want. It's our money. In a nutshell, we have between $700,000 and $1,350,000 to take care of a $250,000 problem and replace our lost income. It's that coverage that helps me to sleep at night. Now, if she had chosen that Obamacare plan with the unlimited benefits, she would have paid her deductible, her coinsurance, her copays, and hospital fees, which is roughly about $10,000. Assuming she stayed in network, which means probably inferior care, the health plan would pay the other $140,000. So she would end up with $140,000 for a $250,000 problem, plus she'd have to find a way to replace her income. Can you now see why 2 out of 3 bankruptcies are due to medical issues and why 78% of those people had health insurance? Simply having a health plan isn't enough, even if they do sell you on the unlimited benefits. So now that you've seen how powerful this plan can be, you're probably wondering what's the catch. Now, there are some rules and limitations that actually help drive down the cost of insurance, but the real reason why these plans are so inexpensive actually comes down to your broker. See, insurance companies pay brokers like me a ton of money, trips, and financial incentives to keep your premiums high and also keep all the business under one roof. Without an insurance broker that's willing to put your financial interests first, you'll never achieve the prices we're talking about today. There's 3 things that your broker has to do to drive down prices 40 to 60% while offering you significantly better coverage. The first, if you're generally healthy, your broker needs to pair you with a company that's going to reward your good health and lifestyle. Second, your broker needs to right-size your plan. You don't want to be underprotected, but more importantly, you don't want to be overprotected and paying for coverages that you don't need and you wouldn't use. Last but not least, your broker needs to pair you with a company that offers the most benefit at the lowest cost. This is often achieved by layering several protections. Understand that most insurance companies are like grocery stores. They might offer 1 or 2 innovative products that have a great price, and they do that so that they can sell you everything else at retail. In many cases, my clients have 3 or 4 policies doing different things to achieve the right coverage. At the end of the day, by lowering premiums, I'm actually lowering my commission. And by writing multiple policies, I'm creating more work before and after the sale. But by taking that extra time, we can save our clients hundreds, if not thousands per month in premium while giving them better access to care. This creates repeat and referral business that far surpasses the cost of lost commissions and the extra time we spent. As brokers, we can make an honest living at what we do. We just need to decide whether we're going to be part of the problem or part of the solution. Now, for all the doctors in the room, let me talk about how these plans help you to achieve better outcomes with your patients. There's basically 4 things that a doctor needs to do their job properly. They need to be able to see the patient, which is your first initial visit. They need to be able to diagnose that patient, maybe through labs, imaging, and x-rays. They need to be able to treat the patient, whether that's a surgery or some medication. and you need to be able to follow up with the patient to ensure that they stay on track and that your treatment plan is working. Now, what sets these plans apart is that they provide more than enough funds in most cases to do all of those things without your patient first hitting a deductible, paying a copay, or paying coinsurance. For instance, if you're a primary care doctor, here are the types of funds a patient would be working with to get the care that they need. $160 a day for physician visits, $300 a day for in-office surgeries, minor things like stitches and moles, $240 a day for x-rays and other diagnostic tests, $700 for outpatient MRIs, CAT scans, and PET scans, $120 for labs, $250 for well care and preventative. You also get some additional money for medication. Next slide. And as you can see, that's plenty of money for a well-informed consumer to get health care. In fact, oftentimes, patients get money back, like me and my family, and many of the people in the room who also have this coverage. So what happens if they need outpatient surgery? Well, the plan pays $5,000 for your facility fee if the surgery includes anesthesia, $2,250 without. Then the plan pays 3 times Medicare rate for the actual surgeon fees. So if Medicare pays $1,000, this plan pays you $3,000 to get the care that you need. Plus you have additional funds to pay for anesthesia and also the assistant surgeon. This completely changes the dynamic of the doctor-patient relationship, especially if you're a direct primary care doctor, since most people on a high deductible plan have to open their purse or wallet every time they get care. They often view the doctor as an additional expense to their insurance. With our coverage, you're actually viewed as an asset, where you can actually protect their physical and financial health while focusing on outcomes. This brings us to the last piece of the puzzle. This is where the plan gets powerful. When consumers know what they're going to pay for care up front, and they have a fully transparent insurance company that tells them exactly what they have to spend, they now have more control over their health and their healthcare spending. Whether it's a doctor visit, labs, or imaging through the Laso app, or getting a bundled surgery price through the Free Market Medical Association, we're truly empowering our clients to get the care that they need while keeping more of their hard-earned money in their pocket. I know a couple clients are in the audience tonight, a few. If you do have this coverage and have received checks from the company, if you could do me a favor and just raise your hand. So Dr. Moczygemba and Deborah. So feel free to ask them about their experience if you talk to them later. Also, I believe in cooperation versus competition. I'm happy to work with anybody, whether it's a patient, a provider, a broker, that's looking to make a positive change in the healthcare industry. Once again, I thank you for your time, and I look forward to your questions.
Thank you so much. Did I promise you too much? No, right? Well, what I heard and remembered when I first learned about this, what? I can see a specialist, I can get healthcare, and I get a check for it? That's what really got my attention. But here's the thing, you need to be a smart healthcare shopper. And that is the trick, right? It's not easy. But luckily, we have, through technology, tools that help us. For nationwide pricing and comparison, you can use the platform Shop Health by the FMMA, shophealth.fmma.org, I believe. But if you are looking specifically here in San Antonio and in Texas for specialists and things that are difficult to find, there's the Laso Health app. And I will let you learn everything about that app by Dr. Reza Mizani.
Thank you, Shankar. Thank you, Byron. I just want to thank everyone for attending tonight's event. You know, for those who know me in the audience, I'm a nephrologist here in San Antonio. I've been here for about 20 years, and I actually trained here in UT San Antonio. Some of the doctors in the audience, we know each other since I was a hospitalist years ago. I started a nephrology medical practice where, one doctor became 2 and then 3. We started seeing a lot of patients. Dr. Bruman is in the audience, my partner in crime. But as years went by, and working in downtown Baptist Hospital mostly, I realized a lot of the patients that roll into the ER very sick, they have a common problem. And some of them actually have health insurance. Some don't, but many do have health insurance. And I started asking questions. So the idea why Laso really started with talking with patients. And the common denominator was they couldn't get the care they need, or they were afraid of the price, which was interesting to me because when you have a health insurance card, you think you have a credit card, and it's not a credit card, right? And each card is different. They have different coverage, different amounts, so they just didn't know. And someone in the audience earlier told me a very interesting example for healthcare price transparency, and that was, imagine you go to a car lot, car dealership, you choose a car, you take the car home, and the next day they send you a bill of $50,000. You're like, whoa, wait a minute. I didn't want to spend that much. But that is healthcare. Healthcare is, last weekend I was in Colorado with my wife. She fell, broke her hand, Olga. And we go to urgent cares. 2, 3 urgent cares later, we actually don't know what things going to cost. We walk out with I don't know how much in medical bills. It's just a black limbo. So Laso is really designed to create price transparency. It's a platform where doctors, providers, imaging centers, labs put up their prices. Price transparency. They put their available appointments, type of service. And the patient conveniently, from their home, their car, pull up their phone, and they start booking different appointments. So when Byron said the smart patient went and found a bundled cholecystectomy for $5,200, where did she go to find it? Who did she call? You see, that's critical, because if we don't have a common place, we don't have a marketplace where you all put your services, where the patients go to find that service and the price. So this is a consumer marketplace app on the phone, but on the doctor's offices is a portal, just like your, the EMR. It is not an EMR. It doesn't hold any patient medical data. It just connects the patient to the providers who's providing the service with a price. And basically, what do patients want? If you look on the left side, patients want transparency in pricing. They want to know, okay, is it going to be $100, $200, $150? Am I going to get further bills? Or that's it? Well, this is a one final price that you put, the providers. You choose what it's going to be. They want to do it without calling 50, different offices and put on hold, and I'll call you back, and I don't call you back. They want convenience of scheduling, and then they want direct access to the doctor or the nurse practitioner or the imaging centers. It's all done via this technology. Now, what does the providers want? The providers actually want access to cash-paying patients. This is not the concierge medicine sort of, you get, a certain amount of dollars per month and then you see them whatever number of times you see them. No, this is, the doctors want another source of revenue that perhaps is not the traditional insurance. And why is that? In our practice, we get authorization for services. Patients comes, we see them. We bill through the insurance company 50 different forms for this insurance, that insurance, all have different things. They deny, we fight it back, they pay. A year later, we get a letter, recoupment because there was a mistake in this and that. But wait a second. It's as if you go to a supermarket, you look at different types of bread. You choose the bread you like, you go, you buy it, and then a year later you got to bring it back because you didn't like it. It doesn't work like that. Healthcare should be like everything else in the country. And recoupment really hurts, bothers me. But also we want to modernize. I mean, everyone here in this room can book a trip right now to China, India, Tahiti. I don't know what other country you like. Right now, you can find the hotel you want to go to. You want to scroll down if you want hotel with all-inclusive, not inclusive. But try to get an MRI 2 blocks down from your house or book an appointment with your doctor right now. You can't. The technology doesn't exist. And I don't think, did I lose it? Okay. It's not because people didn't know about it. I think they didn't want to do it. It really had to come from us, ourselves, people that are involved in the healthcare. I'm a doctor, but I'm sure patients feel the same way. And innovations in the insurance industry, I was shocked what you were showing. It's incredible. It is today. But I think this is a revolution. This is a movement that I think perhaps could start here in San Antonio and beyond, where we put our services online, prices, patients find it, we book it, and after the visit is rendered, the app pays you cash. No ifs and buts. So the technology has two components. One is the app where patients go and consumers and look for services, and on the other side, the medical practice has a portal. So appointments that are booked very easily will show up on your portal site. Next. It's a very easy app to use. Next. And if you look at doesn't do justice, but you can download it and play with it. It's called Laso Health. You can look for different services, find the one you like, book the appointment that you like. I'm going to show a small video if it plays. Find the doctor, provider, book the service, go there. When the service is rendered, your provider gets paid immediately, and you're done. There's no billing involved. There's no mail with super bills and none of that. So let's give it a little time. And the story here is this patient gets a little food poisoning and gets diarrhea. So look what happens. It's going to go slow because I wanted to show it. Patient goes and looks for abdominal pain or digestive disorders. They're just scrolling to look for it. They decide it's there. They read about it, and you in your practice put whatever you want to put there. They book it, and they get different doctor choices. Nurse practitioners, doctors, PAs. They look at the time and date that they like to come. They're still looking. They find the location, the doctor they want to see. And basically, they can do it themselves or someone else can do it for them. And put a little notes, I have this and that, so fever, diarrhea, bloody diarrhea, so that basically the doctor or the staff receiving this patient know why they're coming in. This whole appointments setup takes 60 seconds. I have slowed it down so you can just kind of see what's going on here on the screen. Yeah, slow. And the appointment is done. They can pay with their credit card, they can pay with PayPal, they can pay with Apple Pay, and that money goes in the app and it belongs to the provider, right? But we don't pay it to the provider until the service is rendered. So as a patient, nothing happens until you see the doctor. Memorize that credit card. It's Tim's. And basically, once the whole thing is done, the patient gets a text, gets an email, a little welcome email, and there it is. This is an upcoming appointment. There's past appointments too, if they've had previously. And when they click on that, it has a map, takes them to the particular location they need to go to. Case closed. Very simple, right? On the doctor's side, on the portal side, I'm not going to show that tonight, but on that side, you can change your appointments that are available. Let's say you see 20 patients, 30 patients, regular patients, and you want to open up 5 appointments for this. Well, you can put that whatever time you want. It's very adjustable. If you like to put surge appointments, which are in the high demand time of the day, or it's a Saturday, you want to do telemedicine, well, you can put that. So the future of the app is really going to be telehealth. As you know, right now, you can see a patient in Houston, in Dallas, in your office here in San Antonio. They can find you. We can have physician-to-physician referral. So there's no more phone calls, faxes, and so on. Bundled procedures is what we're actually looking after right now. Gallbladder. It's a good one. It's very common. Appendectomies, knee replacement, hip replacements. But all of that needs you. It needs a participating hospital and a patient that is smart to shop for healthcare services and price. So all of that is it's a process which we need to walk through. We can get predictive analytics. You can find out what type of patient sees you, for what conditions, for what diagnosis, what day of the week, so that you can adjust your schedule. Should I be available more on Wednesday mornings or afternoons when I have clinic? So it gives you input. And later on, obviously, insurance options. Currently is only cash. And why is it cash? Because Byron's insurance company or patients that have very high deductible, they want to shop for prices and good service. It was very funny when I entered the room, I saw the pillars of FMMA. I was like, oh my God, that is Laso's pillars. It's like, whoa. It's equal opportunity, right? Because if you look down there, you are shopping for the doctor and services and the price that you can and you want to spend. It is a value because it's not unknown world that how much this is going to end up costing me, so you actually will not defer care, you will go and get it. And obviously, it's price transparent. That's the key of knowing what things going to cost. So I'm actually going to end the presentation here, and I'm going to leave Noah Almanza information up here. If you're interested to be part of this, it's a free service for you and for your patient. How we survive, and again, this is a local small company, it's just us among friends, is a very small transaction fee so that we can keep our doors open and hopefully provide this service to the patients and providers. So I'm going to end it here. If you have any questions, feel free to ask. Thank you so much for inviting us tonight.
All right. I would suggest maybe, Byron, you go to the lectern as well, and then if people have questions, you can come up here to the mic and ask your question.
It's real bad. There's no questions. Oh, either did a great job. Somebody ask a question.
So I guess, so my question is for Byron. When you look at other players in the marketplace in San Antonio. TRICARE is a major player here because of the military population. And we have sometimes families that, I particularly think of our Guard and Reserve families who go in and out of TRICARE, so they don't have a typical active duty coverage. How do you, when you're looking at your customization of plans, how do you blend that with a Medicaid, a Medicare, or a TRICARE, population? Can you talk a little bit about that?
So one of the big things with what I do is I stick to the fundamental. And it doesn't matter what it is. Insurance is just money. It doesn't matter if it's health insurance, life insurance, liability insurance. And I'm a budgeter. So I'm going in and I'm looking at where the gaps are in their protection. And I'm helping them fill the gaps with the right product for that protection. And I don't know if that's answering your question. Is that, yes? Okay. So what I'll do is I'll actually look at what they currently have and then design a plan around what they have to fill in those gaps.
And then just as a follow-on to that, if you'll allow me, there's a whole nother world that often does not get in these discussions, which is dental insurance, which has a very a different sort of set of, similar, but very different set of payer dynamics. Do you work with people to help them with their gaps in their dental coverage, not just their medical?
Dental's a little bit harder because with all of these carriers, it doesn't matter what it is. The more that you can prove that you're not high risk, the lower your rate is typically, and nobody's going to get into your mouth and start checking your teeth. So a lot of times what happens is people that are looking for dental insurance are looking at it because they already have a pre-existing problem. So there are some coverages out there, but it's not like health insurance where they can look at a medical record and know exactly what's going on. But to answer your question, I do help them with that, but it is a little bit different dynamic.
Byron, this is a question for you. Earlier you said something that was interesting, and I was wondering if you could elaborate on that a little bit to explain for the group. You said that for the insurance companies, the more they spend, the more profit they make. Can you break that down and explain how that is, how they make more profit if by spending more?
So a lot of this is actually caused by the ACA and Obamacare. There's a medical loss ratio that they have, and a lot of these insurance companies, because of the limitation of what they could actually use on actual health care versus profits and things of that nature, they make about 3%. And think of it like a pie. So if you have a pie about this size, and they say, well, now you have to cut your profits in half, well, just make the pie bigger. So the more that they can get you to spend, the more premium that they're paying into it, they get their profits back. So there's no incentive for them to lower your costs because that would subsequently also lower their profits. Does that make sense? So that's how it works, and happy to give you examples of those things.
Come and ask a real hard question. No, not really. One of the statistics that you showed was in the insurance that you provided, they had the top 3 cancer centers, Sloan Kettering, Mayo, and MD Anderson. One thing that I'm seeing again and again is that the ACA plans do not include those facilities. Is that what you're finding?
Yes. Yeah, and that's why I mentioned, even if you do have something like an Obamacare plan that has those unlimited benefits, you also have to ask yourself what kind of coverage you're going to get for that. What kind of actual health care are you going to receive for those dollars? And the thing about American health care, it's great. It's some of the best in the world, but it really depends on where you go. You can go one place and get terrible health care, and then you can go to another place and it's world class. So you really want to have cost you an extra $150 a month. Well, if you paid $100, or let's call it $200 a month. If you paid an extra $200 a month to have access to this care through a copay, and you only see the doctor twice, well, you pay $2,400 to see the doctor twice, which is about $1,250 a visit. Is that a good use of your money? I mean, you could go to the Laso app, get that same visit for $100, and save the other $2,200 and put it towards some other care that you actually need, which is what I do.
So your wife got your services for free. For those of us who are not married to an insurance broker, what would be the typical cost of this really helpful, tailored, personalized service? Let's say you're, an average person with sort of an average choice of employee-based or employer-based coverage, civilian, let's say. What would be an average? I mean, I know you're getting some of your payment as a percentage of the premium, but is there any kind of a fee that they would pay you for a tailored assessment, just like you have a financial advisor who may do that?
So I do charge a fee as far as helping people. I didn't do that for the longest time. The reason why I do it is I want them to be invested in their own plan. And it is something that's very recent, because I would have people that I would spend hours teaching them all the ins and outs of healthcare, and then all of a sudden they want to do one application today, but then they want to do the next one next month, and I have to explain the whole thing over again. So having said that, as far as the cost on it, you're probably going to save somewhere in the neighborhood of 40 to 60% less than what an Obamacare plan would be for just the Obamacare plan alone. And I do include a lot of, obviously, other things in the plan, whether it's the accident protection or the out-of-pocket, so you don't have to pay a deductible, or the critical illness and injury and income protection, which can save you a ton of money. So yeah, to answer your question, it's usually about 40 to 60% less than Obamacare.
I guess I could, I'm a client, I'm like the client also. If my coverage that I had on my, I think it was Blue Cross Blue Shield base plan, it was like $848 a month, now I'm down to like $327 for all pretty much all the coverage you're talking about. So it was huge for me, I'm old, so mine's gonna be a lot higher than some people's. How old is old? You're right. How old am I? Yeah, I want to know. 54, 53, I'll be 54 in a month. What's up, Lee?
So one thing I'll say, now it's working. And he is old, by the way. Any type of insurance that you have, it's going to be based on your age, health, and lifestyle. So the older you are, the more expensive it's going to be. It doesn't matter if it's an Obamacare plan or you're getting it through your employer. The only difference is, getting a little bit of feedback. The only difference is if you get it through a group policy, you have a whole bunch of younger people that are help paying your costs. So it's really going to depend on the situation. I don't actually advocate for one plan versus another. If it makes more sense for them to be on an ACA plan and build around that, I do that as well. So at the end of the day, it doesn't matter what insurance it is. If you treat it as money to help you get the health care that you need, then you're going to make the right decision.
Okay, I have a question for you. Okay. Byron, how does this plan, or does it work with Medicare patients?
It does not work with Medicare patients. There are plans that are similar like this that will work with Medicare patients. This particular plan will only go up to age 64. It's guaranteed renewable to age 64. And the reason why that is, people paying to Medicare all their lives, they literally have the best care that they can get for the lowest cost once they jump on Medicare. So we can fill gaps with different policies, but it is a different dynamic.
So Byron, actually, I'm going to talk to you about the plan. I think, we are a medical practice, and we're being killed by the amount of insurance, money that we have to pay. So, thank you.
So I have a wide range of kind of questions and just understanding your plan. So my job, I'm a practice administrator, so my job is to make sure that our patients are happy as well as my physicians are happy.
Yes.
So just to kind of get an understanding, to talk apples to apples, when you guys explained about insurance company versus what you guys are offering, you're talking about people not knowing what the end result's going to be as far as how much they're going to owe at the end. Well, part of our job is having our own insurance is understanding our plans. Mm-hmm. So yes, recoupments happen, and they definitely happen, and I see them all the time, but I always make sure that recoupments do not actually happen, and we don't actually return that money unless the only time that,
Are you talking to?
I'm gonna, a little bit of both.
Because I don't do
So-
recoupments.
So, I guess I'll speak to him about the recoupment. So recoupments, in our clinic, I don't ever return any money and have to return any money because I make sure that everything is done properly. We're gonna have recoupments, the only time you're ever gonna have recoupments is when a policy is termed and you saw the patient and the policy terminated, the patient's gonna be responsible. That's inevitable, that'll happen from time to time because the insurance takes a while to catch up. But as far as, for authorizations or referrals or things of that sort, as long as you're putting out there the right information and you're not billing or charging for anything outside of, other procedures from what you were authorized, you have a hard copy of an authorization, you fight that, you battle that, there's no reason for a recoupment. So when we're talking apples to apples, I want to clarify that, as far as insurance-wise and us not knowing what the end result's going to be if we have a procedure or not knowing upfront costs, that's the reason procedures are authorized up front, so you know what your upfront costs. So explain to me how this plan is how this is very different from that concept. You're showing transparency in the sense that you're saying you're charging this amount, this is how much the fee's gonna be for whatever service you're having. But the same thing applies with anywhere you go. If you're going to have a gallbladder removal, you can talk to 5 or 10 different doctors. One can charge $10,000, one can charge $12,000. It doesn't really matter what they bill. You have a contract with the insurance is only gonna reimburse you X amount.
Right.
So no matter how much you bill to the insurance, you're still gonna get the same result back.
So
what is
that's.
the difference there?
No, it's very different. So with this plan, it has a defined benefit. So it's going to pay a set amount of money based on a schedule of benefits. So let's take hospitalization, for instance. The plan that my wife has, if she's hospitalized for a sickness, it'll pay $4,500 a night just for the facility fee. It'll pay $6,750 for an injury. That's about double, if not triple, the national average for a hospital stay. But that's all it's going to pay. It'll never pay more. It'll never pay less. It's a set benefit. So did you stay at the hospital? Okay, you're getting paid. Like, it's literally that simple. It's not a, hey, let's haggle with you and everything else. The other thing that you had mentioned is you might have several different prices. With our plan, it pays a set price. So if you did a pre-authorization, let's call it on an ACL surgery, that ACL surgery might be $8,500. Well, if you decide to go to a carrier that charges $10,000, well, you now know you have $1,500 out of pocket. If you go to an ambulatory surgery center that does it for $3,300, now you know you put $5,000 in your pocket. So it's a fixed cost based on that schedule of benefits.
But that's the same as every insurance company.
Well, here's the difference. You got the $5,000 back. The insurance company didn't get to keep it.
Okay.
So yeah, no, that's very different.
So let me touch on 2 small things there. One was the refunds or recoups. From the physician perspective, provider who got up, 2 a.m., went to the hospital and saw the patient, or saw the patient in the office, where appropriate authorization was done, and you went to care of the patient, right? You spent an hour, and patient got well, thankfully, everything fine. The patient had been enrolled in an employer-based insurance, but so happened that they termed them, right? The doctor doesn't know. The doctor provided the service. But then 6 months later, a letter comes that the patient had been termed before you saw them. But the doctor provided the service. It doesn't matter. You see, so Laso app takes that out. It's the service is provided, yes, okay, you get paid. I think it's only fair that if the physicians or NPs, PAs provided the service, they get paid for that. So that's the recoupment that I was talking about. Number 2 is, you ask why the insurance companies or hospitals or healthcare facilities bill different amount if they know their allowed amount is X. Let me explain that. That's a very interesting question. San Antonians have $100 million in medical debt because many of them are underinsured or uninsured, and when they go to a hospital for an illness, they're hit with 80 times the allowed amount. They owe that money to the hospitals or system. You can't just say bye-bye. No, they owe that money. Now, the hospitals do that because there's a variable in reimbursements from different insurance companies. So they do 80 times, one pays 3 times, one pays 5 times, one pays 10 times, and Medicaid probably pays nothing. But they do that because they can do it. But imagine a patient that is underinsured or uninsured, they owe that 80 times the actual allowed amount. So that's why actually we wanted to also give back to the community. Earlier Shankar talked about RIP medical debt. This is a national firm. It's a nonprofit organization. It's in New York. They're basically trying to go around the US and buy debts, medical debts, in a large portfolio. It's not an individual person debt that they're buying. No, they come to San Antonio and they go to the major creditors and say, show us how much medical debt there is in San Antonio, and they say there's $100 million. They say, okay, we're going to pay you $10 million. They're like, oh, $100 million debt that they're not going to recover because people are going to go bankrupt becomes 10. And suddenly they say, okay, sure. All these people in San Antonio that they were under huge amount of debt and they were going bankrupt, they were going to be kicked out of their homes, their kids going to go to school, they have a future. They get a letter from them that says, a golden letter, your debt has been forgiven from an anonymous source. It's really fundraising we're trying to do. We're trying to raise awareness, number one. Number two, if you go to lasohealth.com, it shows you exactly what it does. But if you give $1,000, in you know, all of us, multiply that by 100. That's how much it forgives in terms of local community debt forgiveness. So I hope I touched on those 2 points that you were talking about.
Yeah, and just to say one more thing. So even with Laso, you're talking about, you know, what's the difference. So if I wanted a doctor visit, actually, I think Dr. Moczygemba has urgent care visits that he has on the Laso app now. It's $224, something like that. My plan pays $400 for an urgent care visit. So if I go onto the Laso app, book an appointment with Dr. Moczygemba, I know that I'm getting $400 back for that urgent care visit instead of that money staying with the insurance company. Because right now, how the insurance world works, everybody is trying to get the most for their insurance dollars, which actually drives up healthcare costs. On the flip side, I'm giving somebody an opportunity that they have a set amount of money that they can go spend, and if they do the right thing, they're actually putting money back in their pocket. So they're using resources like this and FMMA to be able to do the things that they need to do and maintain their finances.
And dental's important because dental also falls under major medical as well, coverage depending on what you're in a dentist office for. You
Yes.
can file a major medical claim under somebody's medical insurance when you go into dental, depending on what they're taking
What they're
care of.
doing, yeah.
So they kind of somewhat go hand in hand, so that's very important.
Yes, sir.
Sorry.
Is your plan, the plan you're speaking of, is it a self-funded plan, fully insured plan, or captive?
No, it's just a health insurance plan that's actually not managed, but overseen by Texas Department of Insurance. So it's a defined benefit plan. And there's multiple carriers that I work with.
Okay, so there are carriers that are involved in your plan?
Yes.
That support the losses?
Yeah, they're insurance companies.
Okay. Secondly, access. Most of the problems we have in healthcare is access, you know. You got these plans that have the $3,000, $4,000, $5,000 deductibles. You gotta meet those deductibles. You really don't have access.
Right.
Unless you're coming out of pocket. That's one of the reasons that Roger set up his program the way it is now. So access to physicians in the areas of San Antonio, Seguin, Corpus, Victoria, what does that access look like on this plan? Because it sounds like it's specific to what you've negotiated with certain providers.
No, that's not true. So actually you have access to any provider as long as they're a licensed physician or facility in the United States. You can use it anywhere. The reason why we put a PPO network on there, and it's not a PPO network that's attached to a health plan, it's actually PHCS, which is the largest private PPO network in the country. We put that on there because I don't want to get too much in the weeds about what a network does, but at the end of the day, PHCS is basically renting their network, and they're basically saying to doctors, hey, you give us a discount, we'll send you patients. Yep, kind of like Laso, right? So we put that on there for no other reason than it makes it simple for the patient. But at the end of the day, they can go spend those dollars anywhere they want. So if I have Dr. Moczygemba as my DPC, what do you charge a month? Is it $40, $50 a month for the virtual? Okay, so.
With $10 copays.
Yeah, so let's say that's exactly right. So let's say I go see Dr. Moczygemba twice in a year, I get my labs, and then I also do a wellness visit. At that point, I spent $40 plus the $50 a month, it's $700 some odd dollars, but I would have received back $160 three times plus $250 plus another $120. So his service was actually paid for by my insurance, and now I have my own consultant in the healthcare industry to help me navigate the healthcare industry, get bundled prices, give me wholesale pricing on labs, wholesale pricing on imaging, direct me to resources like the Laso app. So it's actually a marriage between those two, and you can use it wherever you want.
I actually use Roger's business. We offer it through our agency as a benefit, but it's not really a benefit. We don't get paid for it because we offer it as a resource for our clients that can't afford. A lot of their employees, whether they're concrete finishers or steel tires or whatever, they really can't afford healthcare.
Right.
But
And that's, well, actually, let me make this distinction. They absolutely can afford health care. They might not be able to afford health insurance, and that's the difference.
that's it, exactly.
Because if you separate health care from health insurance, because health insurance is just money, and it's money that protects other money if you sustain a financial loss,
Exactly right.
then you can actually do some amazing things, but you have to treat things for what they are.
So the same applies to employers. Some employers, because of their overhead, they can't afford the cost of that healthcare. So, but they can afford the $50 a month per head, or $59 per head per month, and now those employees actually have access.
Yep.
So we offer it through our agency, which is here in San Antonio, and we're in 46 other states, but the plan, it's challenged because of facilities in some cases. And in your case, you're saying you've got pretty much access to all these facilities, whether they'll take your number that you've set for that procedure, or it may be more, but that's the number.
Yeah, typically it's more than enough. I mean, when you're talking about, again, hospitalization, you're talking about double, if not triple, what the national average is. 3 times Medicare rate for surgeries. Surgery centers is paying $5,000 for a surgery with anesthesia just for the facility itself. I mean, it's, do you do anything with reference-based pricing? Okay, so you understand that, you know, Medicare to about 130%, that's an excellent price. 130 to 170 is a fair price. 170 to 200, that's not great. Anything over 200%, that's kind of like usury. I mean, the government does all these studies and says, hey, this gallbladder surgery is $5,525. If they want to charge 11 or more for that, that's kind of a problem. Like, you just have to ask for your money back. So this plan is designed where it pays 3 times Medicare rate in most instances, or something close to it.
Understand that, that makes perfect sense. One of the reasons that Roger's plan works so well is because it drives down utilization on your health plan.
Yes. And the thing is, most people think that somebody else is paying for their health insurance. That money has to come from somewhere. Insurance companies don't have a money tree. It's from our premiums, our co-pays, our co-payments. Your employers are paying it. It's part of your compensation plan. The government's paying it. It's part of your taxes. Like, you can't get away from it. It's coming out of your pocket. The question is, do you want good health care, and do you want something that actually offers you protection? And that's what that kind of comes down to. Thank you.
Very quickly, I mean, all these discussions, and both of you have touched on it, are about empowering consumers and making them more sophisticated in terms of their education and their choices. And I think it's true that if you have the time to shop around, whether it's for bread or a cholecystectomy, you're going to get a better bargain. But many times healthcare decisions are not made with leisure time. It is an urgent issue. You gave the example of your, hand injury on a vacation. So when you look at the defined benefit plans that you have, if I don't have the time or the educational background or the language skills to shop for a better price, how does your defined benefit carrier help me to make that decision so that I know if I don't have the Laso app, and I know you were going there with that, I saw it, I did too, but if I don't know about the Laso app, and I don't, that's why I'm not yet a sophisticated consumer, because the vast majority of my patients, my whole career, have not been. I'm negotiating the system for them. I'm the one that has negotiated the cash MRI price so that they don't have to, because they may only get one MRI in their life. So how do you help that consumer be more savvy to find that better pricing? It's in your interest, of course, to save them money and to save you money. How do you do it?
So we do it a couple ways. There is advocacy that's included in our plan. I'm available to my clients 24/7. If somebody calls me up at 4 o'clock in the morning because it's that important, I'm picking up the phone. That's just the way I am. I mean, I don't want you to make a $10,000 or $15,000 bad decision because I didn't want to wake up. So the commission that I get, that's what it's for. It's so that I can actually service that client. Having said that, we do need to take the time to start educating the general population, and we need to put more tools and resources like FMMA and Laso in front of people so that they better understand how all of that stuff works. Because it's sad, but almost 20 cents of every dollar spent in America is spent on healthcare, but half the people don't even know how healthcare works. I mean, if you think about that in terms of GDP, if every American that started January 1st worked all the way until, I think it's like the first or second week of March, every dollar that we make would be earmarked for healthcare. If you can't take the time to understand how healthcare works, then you're doomed to be broke anyway. So we just need to be able to get out there and educate people, let them know what those tools are, and then also give them tools like ourselves to be able to assist in that.
I think go ahead, Olga.
So I have a question about the Laso app. So have you seen any price? Have you seen any price drops? Okay. Have you seen any price drops?
So the question
with
is if
the
there's
app,
any
right?
price.
Because let's say I post that I charge, let's say, $150
Yeah.
For follow-up, and then I know there will be doctors like Dr. Yanis, for example, who are competitive, and they'll say, well, I'll charge 50. Have you seen change?
So you see, the app, I haven't seen that, to answer your question, okay? It's pretty much, most people charge whatever the allowables are for major insurance companies, and they don't drop the prices. It's really more for price transparency, knowing that the patient that is seeking the service is going to get one bill, and that's it. There's no more bills coming in the mail. I haven't seen that, what you asked, Olga. I think more people are going to be focused around convenience, times, and just knowledge, knowing that what are the prices out there. Robert, I think you asked about what are we doing in terms of patient education. Nothing. That's what we're doing, nothing. Because I don't know what things cost in different cities, and there's a reason why we do nothing. Because there's large competing companies that want us to do nothing. And I think in meetings like this, where we all get together and we come up with ideas, I'm sure you sitting there, you've come up with ideas already of how to talk to your patients, to your office manager, yourself, how to do things. This is where we start the education. First, us getting educated about what's out there. I mean, this was an incredible presentation. I'm a consumer for healthcare, and we have 100+ employees, and it costs a lot of money to pay for the premiums. So I learned something. I think we need to do a lot more about patient education and awareness. We would love to talk about how we can collaborate in that. At least start it in San Antonio and then see what happens.
And what I would say, so if somebody did have an emergency, let's say they ended up at the emergency room, obviously they're not going to be able to shop prices anyway because it's an emergency. So at that point, what our advocacy and bill negotiation would do afterwards is they would go in and negotiate. And just like I had told that gentleman there, anything over 200% of Medicare, that's kind of like usury at that point. So there should be more than enough money in most cases that it's just going to take care of itself.
I would suggest that one receptive or a group of receptive forums would be patient advocacy groups. So in my world, in pediatric endocrinology, that's like the Juvenile Diabetes Research Foundation, Magic Foundation. So there are sort of very patient-driven patient advocacy groups that would be receptive to these kinds of presentations. And very often in these kinds of settings, we're sort of preaching to the choir within an echo chamber. So that's why I raised that issue of the people who are not here, the dentists, the patients, and others.
Yep. Yeah, and I'm familiar with several patient advocacy organizations, but I haven't reached out to them. So I'll definitely talk to you about maybe ways that we can address that.
And going along that same line, one of the most recent major surveys that was across 140 million folks that had health insurance, less than 2% of those people ever shopped for anything. And of course, that's because they're using somebody else's money.
Right.
Right? So I love the concept of what you're doing. I'm a broker also. So I love the concept of what you're doing, saying be more responsible, because now it's your money, right? I mean, obviously I care more if it's my money than if I'm spending the insurance company's money.
Right.
Because we've been trained, exactly what happened earlier. Health insurance and healthcare are the same thing, right? It is not. Right. But look, where do we get our health insurance from? Where do you get your Obamacare from? Healthcare.gov. Yeah. They've never sold one piece of healthcare ever on healthcare.gov because you can't buy it there. Right. You buy health insurance. Mm-hmm. But the biggest problem I still see is how do we get people to shop? And where can they shop at? I love that Laso app, by the way. My daughter has an appointment to get her wisdom teeth out with the dentist that does that on there, Dr. Havacor, yeah, there you go. So I did it all through your app. It rocks. That's awesome. Okay? So, but I think it's on us because it's not just the advocacy, but we've got to do more things. We've got to get Laso nationwide, not just in San Antonio. We've got to have those type things where it makes it easier for people to look in their palm of their hand, even if it is an emergency. If I had a Laso app and it's an emergency, I can still do it quick, right? But if I have to log in, I have to figure out how to log into my insurance account and then do a doc search, I'm just going to go to the nearest place. Right. Yeah. Every single time.
I'll give you an example, and I was telling Troy about this on the way down. So one of our business clients, the owner of the company actually needed a shoulder surgery. And his deductible, I think, was $6,000. The actual shoulder surgery itself at Memorial Hermann up in Houston, I think it was like $57,000. We found him a bundled price of $7,000. And he's like, well, if I only have to pay $6,000 for my deductible, why would I not get it done with my doctor? And then we had to explain to him that he's the business owner, so even though he's only paying $6,000, his business is paying the other $51,000. And that's the difference. When there's no incentive for somebody to change their habits, then they're not going to change their habits. But with this plan, I'll give you an example. We had one client, he spent 10 days in the hospital because of COVID. Now, he's not my client. He actually had the middle of the road plan, not the top of the line that I design around. Spent 10 days in the hospital. I think they billed $58,000.
Exactly. A question about the plan itself is it available for groups?
It's available on a list bill.
Okay, but even more so, it's not going to be a qualified plan, right? So if someone's got 50 or more, they've got to offer a MEC also.
Correct.
They have to offer it. Nobody has to take it, but they have to offer it. Right? But my point is you can still develop it for groups, right? Okay, great. We need to talk.
Appreciate all the questions.
Byron, a question for you. All right, two questions probably. So on the type of plan that you have, and you talk about your reimbursement, so from the time that you either submit, because you paid cash out of pocket when you went to the doctor, to the Philadelphia America, whatever it is, right? what is the average time for reimbursement for the service that you did?
So after they get the claim, it's usually within probably about 2 or 3 weeks that you'll have a check in your mailbox.
Okay.
Experience has been about 14 to 17. It's, to me, I was the guy that paid a ridiculous family plan for so many years. I set so much money on fire. So the concept of getting the check back after I go to the doctor
It's mind blowing. You gotta think different. You gotta think different. Yeah.
You go to the chiropractor and get checks back.
Yeah.
It's a weird thing. It's different.
It was ironic when we first got on the plan, my wife, she would get these letters in the mail and she'd see the company on there and she wouldn't open them up.
She was scared.
And it got to the point where she got tired of cashing checks. She would have stacks of checks on her refrigerator, waiting to go to the bank and cash it. Like, I'm like, this is real money. But that's neither here nor there.
And then I guess the second part of my follow-on question to that, so when you do submit to Philadelphia, America, Manhattan, whoever you're using, is it uncommon for them to go to every one of your doctors and ask for medical background from each of your doctors?
So with the plan itself, it does have pre-existing for the first year. So it's intended for people that can answer a certain set of health questions and then ultimately be able to stick to that for the first year.
Right.
So that's actually a protection for the plan itself and everybody on the plan, because the last thing that you want to do, it's like if your house was on, It's what they call buying claims. It's like if your house was on fire, that's not the best time to call the sprinkler salesperson. Does that make sense?
Yes, it does.
So you want to get the coverage before any of those things happen, and at the end of the day, the best time to buy insurance is when you don't need it, but we've trained people the opposite. We tell them to wait until you get the cancer or something like that and then sign up for insurance. Well, at that point, it's too late because you're always going to get the highest rate. So again, to kind of answer your question, within the first year, they will check to see if there's pre-existing. After 1 year and 1 day, 100% of everything is covered without any pre-existing on that plan.
Okay, thank you.
Yep.
All right. If there's no other question, thank you so much.
Thank you so very, very much. Thank you, Laso. Thank you, Byron. Thank you all for coming. Thank you, Karlo, Rodrigues, for helping us live stream. Don't forget, you can sign up to become a member of the FMA, and you can network, you can talk to the people who spoke here, and have a great evening. Get back safe. What? And the national. Yeah, the national conference of the FMMA, you're right, August 5 through 7 in Dallas, the national conference where Steve Forbes is actually one of the keynote speakers. So that should be very, very interesting. And you can get your tickets on fmma.org. Thank you, Harlan, for reminding me. Have a great evening and get home safe. Thanks for coming.